Hey, good evening. And so, as you have spoken about with the current administration, there are some uncertainties when it comes to budget cuts and if Medicaid would be one that experiences cut. And you heard the governor say there is a focus to make sure that doesn't happen. And there's actually new research that shows when social needs are met, the cost of Medicaid actually goes down over time.
When my son was born, he had to start chemotherapy at 6 weeks old. I ended up having to quit working to care for him. And so I'm one of countless North Carolinians who can say that Medicaid literally saved their child's life.
Felicia Burnett is the National Director of Healthcare for Moms Rising. It was that experience with her son that prompted her to join the group that advocates for health and well-being of women and children.
We've spoken with parents, thousands of parents, all across the state in all 100 counties. And Medicaid really serves people in so many different ways that we don't even understand.
A recent study published in the Journal of American Medical Association showing how a state pilot program in 3 rural communities in North Carolina helped reduce Medicaid costs long term. The NC Health Opportunities Program, providing assistance with things like transportation, food, and housing, was approved in 2024 for up to $650 million over 5 years.
We could not only improve people's health, but reduce the need for some of the downstream consequences of poor health, like the need to go to the emergency department or be hospitalized.
Seth Berkowitz says the study found over time spending trended downward by an average of $85 per beneficiary per month. The penny-wise, pound-foolish approach, if Medicaid funding is cut, would impact thousands of people in hospitals right here in Central Carolina.
It seems like funding for all aspects of Medicaid is a little bit up in the air, and so we don't know, but I think it certainly is the case that programs like the one that we evaluated could be under threat with budget cuts.
Mothers and advocates feeling the same.
If the federal government cuts Medicaid, it will shift those costs onto the state, and then the state is going to have to decide, do we cut people off of their coverage? Do we roll back services for folks? The state is going to have to make a lot of really tough decisions, and it's going to impact folks all across the state.
And so that group, Moms Rising, they tell us that they will continue to share stories of those who live in rural counties across the state with the lawmakers and really show them that those families really benefit from Medicaid. So again, we'll continue to keep tabs on this and continue to watch as things come down from the White House.